this last session يعني is going to be moderated by Dr. Muna and Dr. Mayada. Both of them are very senior, well-known. I think all the Sudanese, not just the doctors, the medical field, they are very well-known two people. وأنا حقيقة I'm very grateful. يعني أنا ما أقدر أتكلم عنهم كثير لأنه الزمن، لكن حقيقة الجروب بتاع أنا ما أعرف اسم السودان بالعربي اسمه شنو يا ميادة عشان بس ما أغلط في الاسم. unmute yourself يا ميادة.
مجموعة المهتمين بشؤون السودان تحت الكلية الملكية للصحة العامة.
طيب مجموعة المهتمين بشؤون السودان ديل، وهذه دكتورة هدى الحمد لله دخلت معنا. أنا داير أقول في وجههم كلمة، مع إنه شهادتي فيهم مش مجروحة لكن هم سودانيين يعني نحن عاشرناهم بالسنين، لكن حقيقة أنا داير أقول كلمة مهمة جدا هنا. أول حاجة هم من الفاوندرز مما بدينا منصة السودان للمعرفة 2008 هم كانوا معانا وعندهم صورة مشهورة، كلهم قاعدين في صورة كده، هدى وميادة ومنى وكلهم كانوا إشراقة وديل. حقيقة يعني أنتم بتشوفوا علاء وناس، لكن الناس ديل قووا معانا الفكرة دي من زمان. والحاجة الثانية مهم جدا العمل اللي بيعملوا فيه في الببليك هيلث. أنا ما دكتور وفي أطباء كثيرين عارفهم مشاهدين لسه متابعين، لكن غير الأطباء بيأكدوا على كلامي ده. دور الصحة العامة والببليك هيلث مهم جدا جدا في كل حياة الحياة، وحتى نحن عندنا مجلة متخصصة في الصحة العامة. لكن أنا قبيل يا دكاترة كلكم يا ناس الجروب اتكلمت قبيل من الصباح لما بدينا وبنوي، وأنا هسه إن شاء الله I will try to get المينستر بتاع الهيلث إنه يتداخل معاكم. قلت يا جماعة ديل ناس يقودوا الصحة العامة في قمة بلدان العالم، يعني أنتم كلكم ما شاء الله منى وهدى وشراغة وميادة ومعاكم استاندي، يعني ديل the best of the best. أنا ما أقدر أقول ديل are the only best. عندنا دكاترة في كل العالم يقودوا الصحة العامة دي في كل العالم، ناس بروفيسور باني وفي السعودية وفي الإمارات، لكن في بريطانيا اللي عايشين فيها دي those are the best of the best حقيقة. يعني هم بيقودوا الصحة العامة على مستوى المملكة المتحدة، مش على مستوى السودانيين، لا كلهم ما شاء الله عليهم. أنا ما أقدر أطيل، السيشن ده مهم جدا وأنا سعيد جدا إنه متداخل برضه معاهم من السودان الدكتور نادر أبو زيد أسوسييت بروفيسور من أوائل الناس اللي نشروا عن الكوفيد. أنا تقريبا this is my last word. I will hand over. عندكم you are a very safe two captains زي ما بيقولوا، وأنا I will just be on the back أساعدكم يا ميادة ويا منى لو في شات عملوا لي أي حاجة دارينها، و the control is yours. أنا الاثنين عندكم co-host وأعملوا زي ما بدالكم زي ما بيقولوا. أنا حاول follow up معاكم، بجيب لكم الأسئلة ومعاي كل الناس. We will help you. يلا السلام عليكم.
واصلوا. إن شاء الله إن شاء الله. بسم الله الرحمن الرحيم والحمد لله والصلاة والسلام على رسول الله. إحنا سعيدين جدا بإنه يعني إحنا اتيحت لنا الفرصة إن إحنا نقدم من خلال منصة السودان للمعرفة، نقدم نماذج بسيطة عن عمل الصحة العامة في وقت من الأوقات يعني هو حرج جدا وحالة طارئة جدا، وهو الكوفيد في السودان. واحنا مجموعه يعني ومعانا كمان برضو من الزملاء الناس ما قدروا انهم هم ينضموا لنا اليوم، لكن احنا هنتكلم يعني بعض النماذج عنهم يعني. وكمان سعيدين انه معانا برضو من ال Faculty of Public Health we have Andy Beckingham. أندي هو يعني هو برضو من الناس المهتمين بشؤون السودان وبشؤون العالمية عموما، وعمل معانا في السودان يعني في بعض المأموريات في السودان، فهو حيتكلم يعني حيتحدث برضو يورينا كيف هم نشاطهم في الصحة العامة عموما في العالم وبالذات بالنسبة للسودان ده معناه شنو. فهو يمكن استسمحكم أندي هو حيتكلم بالإنجليزي وأنا بعد ذاك حاحاول أترجم بالعربي. طيب فإن شاء الله يعني هو في البداية هو حيقدم كل واحد فينا حيقدم نفسه وحنقدم الموضوع اللي حنتطرق له، وحنحاول إنه يكون الكلام يعني فيه باللغة العربية وقد يكون فيه برضه البعض باللغة الإنجليزية، لكن نحاول إنه السيشن إنه يغطي كل الجوانب دي. فنحن حنعرض على يعني واحد بعدين تلو الآخر إن شاء الله، وفي التقديم بعده في النهاية إحنا حيكون عندنا فرصة ناخذ الأسئلة، وحيكون عندنا فرصة إنه يعني نناقش بعض الأمور اللي حتطلع في الفيسبوك في الشات وغيرها من الأسئلة اللي حتجينا من خلال بروف علام أو برضو من خلالنا نحن ميادة برضو هي حتكون بتاخذ بعض الأسئلة. فأنا بفتتح السيشن دي وإن شاء الله معانا حيكون دكتور أندي بيكينغهام. So Andy will be able to present something about the Faculty of Public Health, about the Sudan Special Interest Group, and some of your work, Andy, in Sudan. So I'll hand over to you, and I know you've got a presentation. Hopefully the technical issues will be resolved and we'll be able to see your presentation alongside with yourself. So Bismillah ar-Rahman ar-Rahim, we will hand you over to you.
Assalamu alaikum, thank you. I'm trying, can you see my presentation?
We
Yes.
can see.
Oh good. Good. I will try and make it work.
Just press on the show screen if you don't mind, Andy, Dr. Andy. Just to make it bigger.
Present it as a PowerPoint slideshow.
Slideshow.
Yes.
So it will come big on the video, yeah.
I'm trying.
You know the screen sign on the bottom, on the slides?
The easiest way
Sorry,
for Andy would be to go under the menu for slideshow. So at the moment it's on the home menu. If you go to the slideshow menu, and then you'll find how to present from there.
I'm trying to make the screen big. I can't see. Help.
Andy, on the top, you can see slideshow on the menu. Can you see it on the top? On your PowerPoint.
Yeah.
Yeah, just click on that one.
You are screen sharing.
No. It's slideshow. On your PowerPoint.
On my PowerPoint. Oh, I see what you mean. Yes. I beg your pardon. Here we go.
That's
okay.
Oh, great.
Welcome. Thank you. I'm really honoured to do a presentation. Why would you be interested in anything that I have to say today? Well, mainly because I'm introducing my Sudanese special interest group colleagues, whose work I have long been in awe of. They've made contributions to Sudan's public health over the years, and they have huge potential to contribute further. And you will hear further from them individually. But secondly, Dr. Muna told me, I don't know if she was right, that you might be interested to hear some brief impressions from me about my times working in Khartoum with the health professions. Well, perhaps you may. I'm going to do that based on my wider experiences in public health of what works for countries, because I've worked in and with a few, usually at a national level, policy level, and curriculum and education. So all of what I say today are my own views, and they may not be shared by my SIG colleagues. So if I blunder terribly, then they are innocent. My blunders are mine alone. So the Sudan Special Interest Group is very important in UK public health because they're one of the powerhouses of our professional faculty. The members of the SIG are, probably apart from me and one other, Sudanese professionals who have extensive experience of delivering really effective public health work. And they've done this, a lot of it, in a memorandum of understanding between the faculty in the UK and Sudan's Public Health Institute. And they have just provided huge amounts of that input and made big impacts that I've seen and read about in Sudan. And so what I'd like to do today is to pay tribute to their work. And if you didn't already know, the Sudan SIG of the faculty has much further potential to work with Sudan, especially at this time. So unlike me, my SIG colleagues have decades of public health experience in the two countries. Yes, I've had nearly 30 years of public health experience, but I didn't come from Sudan. They did, and they are children of Sudan and understand the systems really well. But they've done this amazing thing, which is to qualify in medicine and public health and so on in Sudan, and then make their way through the UK's health system and make it to become senior professionals here. And so they've had to learn how you use both systems to impact positively on public health and make population health changes that stick. And those are outstanding achievements that my colleagues have done. Right now, after me, you're going to hear about how they offer to help Sudan's most pressing public health need at the moment, the pandemic. But further to that, I would urge Sudan to work with the SIG members on multi-sector work to embed public health work through the economic and social determinants of health. And my colleagues have for some years worked in and with Sudan to build partnerships, often with public health, but often with other sectors and with communities, doing things like increasing health literacy and self-care, which are so incredibly important to balance the actual health care in Sudan. So in a few minutes, you'll hear them report on the biggest crisis currently facing Sudan. But here are just some examples of what my colleagues have done over the years, and they've actually made huge contributions to the Faculty of Public Health's ability to impact on global public health and delivered a lot of that. So I guess some of you will know that my SIG colleagues have led or contributed really actively to a lot of public health issues in Sudan, such as malaria, maternal health, and so on. They've held lots of training workshops. They've worked with the agencies. I've read reports that my SIG colleagues have written or co-written in and with Sudan. And they've led initiatives at many levels, particularly with the Federal Ministry of Health, and provided education, policy development support. They've contributed actively to try and help. And so Dr. Muna I saw her on the Global Health Committee, worked tirelessly to support international public health professionals with their CPD, which is you know, difficult for them. I've seen my SIG colleagues work tirelessly. Also, they've helped a number of Sudan public health professionals make that link with the UK and become faculty members of the UK. They've delivered loads of other things which I don't know about. Here are just a few. And they have done this over many years. They've worked on strategic public health initiatives with Sudan. One of my SIG colleagues helped lead the development of palliative care strategy, which makes an immense difference to literally thousands and thousands of people facing the end of life. And unlike me, being children of Sudan, they understand Sudanese culture, and so they're uniquely placed to contribute. So I'm going to shut up about them now, and I'm going to leave it to them in a moment to present their own professional recommendations. But Dr. Muna did ask me, you came to work in Khartoum, Andy, maybe you can share some impressions. And indeed I did. I worked in 2015, 2018 at the Federal Ministry of Health with some really distinguished colleagues. And I worked with the leaders of the Sudan medical professions and all the health professions to try and introduce some strategies to support the health professions and medical professions in Sudan, where I don't need to tell you, you face big barriers. So I've worked in a few countries. I worked in India and set up what's becoming a national initiative. And so I'm trying to give, I hope I'm able to give an independent view from outside, if it's helpful. Muna said it will be of interest. For me, when I worked in Sudan, I saw that a huge amount of your culture, which contrasts so greatly with mine in the United Kingdom and many Western countries, your culture protects health. You probably may not see it. Your religion, your culture, your charity, your cultural values binds you together in a way that we can't do, that we've lost in the United Kingdom. This is something that the world could learn from Sudan. In my country and in Western countries, we have fragmented the generations. Older people are mostly lost and lonely, adrift often. Young people are disenfranchised. They are not bound together as they often are in Sudan. I know I'm generalizing. This is immensely important. Your culture, your safety, your traditional food are massively protective to your public health. Treasure them and protect them. Many countries, many large countries will want to try and replace your values and your traditional foods and your ways of life with modern commercial foods of no nutritional value. The big industries, the tobacco industries, are all ready to sell you things that you shouldn't buy if you value your population's health. Unless you want to see the massive rise in chronic diseases that we've seen in my country over the years, which then eat up nearly all of the health budgets. The SIG and the Faculty of Public Health could assist with that if you want to do that. But I would say, think about Sudan's culture and how much it protects the population's health. I'll never forget my experience of working in the Federal Ministry of Health. I was incredibly impressed by the qualifications and the experience and the skills and knowledge of my colleagues in public health and the other health professions with whom I worked. I was astounded. But one of the most basic things, this is an example of your culture that protects health. I sat around the table with everybody, the cleaners, the boss, the senior professionals, the country's chief midwife, my dentist colleague, and we all shared food. And this protected and uplifted me during my stay in Sudan. I can't tell you how important that is. We can't do that in the United Kingdom. Yes, we can have family dinners, but it's usually around a television. Sharing healthy food that you'd all made, that's a tiny thing that you do in Sudan. But that's something that has an enormous impact on public health. That literally adds years of life expectancy to those people who can do it. Having your your faith and sharing with people, your traditional charity adds years of life expectancy to people, and it prevents the massive mental illness that we see in my country, because all those things have tended to be lost by things like video games and online shopping. Sudan has an enormous amount to teach the world, and I do wish we could learn from you. Please incorporate those into your national health strategies. I worked with and I listened to all the Sudanese health and medical professions to help clarify their scopes of practice and to create a modern career structure. And I did this because some of those structures and career structures and CPD structures hold back the professions developing and working together. We know that there are barriers for professionals in Sudan to work in health, but I believe that unless the career structures are modernised, the health professions will go on seeking more and more qualifications when what Sudan needs is more and more basic care and prevention. And the day before I left, the health minister was about to reorganise that system and bring all the health professionals and the doctors together to work collaboratively. And then the revolution happened. Sudan's got fantastic medical and health education and training institutions and programs, but not all your educational establishments are serving that. I would urge, please excuse me for saying these things, they are simply my observations about what might help. There is a real need to make, to align all the medical and health, higher education in Sudan to meet your national public health goals and to support prevention and primary care, and to maneuver it away from ever increasing focus on tertiary care. There is a real need to focus health professionals' capacity on prevention across Sudan, rather than on just treating people when they become ill. There is a real need to do what briefly a government in my country did in the 1990s, which was to say all the ministries, education, transport, finance, the treasury, health, you will all work together, and you will all work together and talk to each other to agree to try, whatever you do, it must improve the population health. And this should be led by a public health strategy to do that. That's since been lost in my country. The government of the last 15 years has ignored public health advice. Please avoid their mistakes. A health minister in Sudan who drove all the ministries to work together to improve health, especially education and the environment, finance, would make immeasurable improvements in Sudan's public health. This is it. That's it. Those were my observations. I hope that I have not blundered too much in giving those. As I've said, I have no personal axe to grind. I treasure your country and its public health system and its health protecting cultures, and I'd really like to see them able to refocus, perhaps with the help of the SIG, around more preventive and primary care, and to focus all the health professions and education on that. Those would be my professional recommendations. I hope I haven't blundered too much. That's it from me. I hope you're now going to hear much more interestingly from my colleagues.
Thank you very much, Andy. That's been amazing. Thank you very much. And if you don't mind, I will start to translate, but you can unshare your screen now, and then maybe more people will pop up on the Zoom. So I will translate to Arabic, so if you allow me. عندي هو بيتكلم نيابة عن الكلية الملكية للصحة العامة ببريطانيا، وبيثمن الخبرات السودانية داخل وخارج البلاد، وإنه اشتغل يعني عمل بالسودان فترة 2015 و2018. وأكثر حاجة يعني استرعت انتباهه هو ترابطنا الشديد ببعضنا والعلاقات الاجتماعية وتراثنا السوداني وديننا الإسلامي، كيف إن إحنا بنهتم ببعض، نهتم بكبار السن، كذلك يعني تذوب الفوارق الاجتماعية حول صحن الفول زي ما بقولوا، ودي كلها أشياء يعني استرعت انتباهه. فهو يعني أكثر حاجة بأكد إنه إحنا ما يعني نحاول نحافظ على نقاط القوة اللي عندنا من خبراء وعلاقات وكذا، يعني على أساس إنه بيثمن دور الخبراء الصحة العامة في بلدنا. عمل أندي في السلم الوظيفي وبعض التخصصات المختلفة المواتية للصحة العامة، ومن أهم الريكومنديشنز أو الأشياء اللي هو يعني بيأكد عليها إنه يجب التوجه إلى الرعاية الصحية الأولية والبعد من التخصصات الدقيقة، يعني التوجه إلى الوقاية. ودي فعلا رسالة مهمة لنا، وبقدم يعني شكره والمساعدات الممكنة من الكلية الملكية البريطانية. ونحن من قبل يعني عندنا أعضاء كثيرين من داخل السودان انضموا للكلية الملكية هذه يعني، وإن شاء الله كلنا كمجموعة مهتمة بشؤون السودان ممكن نحن كيف نخدم البلد بخبرات سودانية وغير سودانية زي ما نحن شفنا. فأنا حأنقل الوقت الآن لميادة. ميادة إن شاء الله حتكلمنا عن القيادة. فميادة لو يعني قدمتي نفسك وقدمتي الموضوع اللي أنت حتتكلمي فيه وإن شاء الله على عجالة. تفضل يا ميادة.
بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ميلاد. بنحلم بفضاء أوسع، بنحلم بزمن أجمل، بلاد ميلاد، بلاد ممتد لحد حدود